Hi, everybody. Dr. Jake here. And today I'm going to talk about Shockwave in relation to low back pain, particularly facet joint issues and disc issues. And so there's been several studies that have come up. Most recently, there's been a few in 2025 that really shows the efficacy of shockwave therapy and use of these conditions. And so one study in July showed that lumbar facet joint pain was a prospective randomized sham controlled, which means they used shockwave and then a sham system and looking at the outcomes. And the results were the patients receiving high energy focused shockwave showed a 64.4 reduction in pain and a 42.3 decrease in disability score after 12 months. So that's after 12 months. And so usually visits can be anywhere between 6 to 10 weeks. And so this is several weeks and several months after therapy that they still showed this type of deal. And they also did MRI findings. Follow-up imaging showed resolution of bone marrow edema in nearly 60% of the treatments compared to 0 in the sham. And so just some really cool studies that are coming out. In addition, there's a lot of studies talking about disc regeneration. And so we know that disc can regenerate. Now, the problem is they're avascular, so they don't have a blood supply. So they get nutrients from movement. But if you have a stubborn segment that's not moving, that's going to cause issues. At the same time, if you have a herniation or a legit injury in that area, then regenerating the disc is going to be highly important. Otherwise, it continue to degenerate and cause more issues. And so the shockwave therapy allows for microcirculation within the surrounding areas to make sure that it's regenerating and also increasing cartilage and collagen in the area. So it makes for a better joint. Better joints move better, more efficient, and so it allows the disc to actually regenerate. In addition, there has been several studies showing this compared to epidurals or steroid shots. And so epidurals and steroids, they both have some significant side effects. It can actually contribute to more degeneration into the joints and the disc themselves. And so and looking for other therapies, regenerating therapies are highly hot right now. And so that's why there's a number of studies to figure out what direction medicine should be going. And shockwave therapy is at the forefront of that. It's one of the most conservative and cheapest routes in regenerative medicine. And that's because it does have such great value. And so studies have shown that shockwave therapy has the same analgesic effects as a steroid. However, it's setting up an environment for healing instead of breaking it down. So it has a lot longer lasting effect in the recovery process and decreasing pain and getting back to a better quality of life. And so if you have any of these issues that are occurring, definitely reach out or let us know, and we'll get you set up in an appointment. We make it very easy to start up your initial consultation, and that also includes your first shockwave therapy. And then we see what your results are. So we usually get back together and see how you responded, and then we figure out the best game plan moving forward. So again, Dr. Jake here, happy to help. Let me know. I love you guys. See you in the clinic.